Hi, I'm Dr. Peter Nightingale. I'm a GP in Lancaster, but I'm also the National Clinical Lead for End-of-Life Care, which is a joint post between the Royal College of GPs and Marie Curie. Pain is one of the most unpleasant sensations that humans can endure. Pain related to a disease can actually be caused by that disease itself. It may be pressing on nerves or causing pressure. Or it may actually be caused sometimes by the treatment that's being given to deal with the disease. There are many factors that will affect an individual's response to the pain that they're getting from their condition. Main ones are tiredness, exhaustion. Anxiety can really affect the amount of pain that you suffer. Unmanageable pain is extremely rare. Most of the time, by using the drugs that are available and other techniques as well as on top of drugs, we can deal with pain. So that's the important point to bear in mind. We know that the same disease in different people can produce staggeringly different degrees of pain, from none, thankfully there are quite a lot of people that get no pain, to some where the pain may be quite challenging and we may need specialist help to deal with it. We know that individuals' thresholds for pain, for the pain they experience, varies enormously. It depends what's going on in their life quite often. If you've got a situation where you're socially well supported, you're not worried about anything, finances are sound, everything's good, then the pain experience will be different. We also know that people's ability to effectively express what the pain is like varies, and that's our job, to try and build a relationship so that we can understand for each person what we need to do to really manage the symptoms, because most of the time we can. It is so important that we understand your pain experience, how bad it is, how it's affecting your life, is it stopping you sleeping, what impact it's having on relationships. So communication is vital, and what we're aiming for is mutuality, that we're almost seen as a meeting between experts as much as you ever possibly can have. Patients, the expert in their life, they've got their pain, they know what's going on in their world. We know a bit about drugs and pain management, and we can meet in the middle and try and solve this problem together. There's a great temptation, if pain is troublesome, to hide away and just try and deal with it by yourself. But we know that in many situations that actually heightens the pain experience, because you have nothing else to think about but the pain. Having a carer around that can help you with all the aspects of pain, whether it be medication, just keeping you busy, keeping you occupied, and hopefully actually caring for you, that feeling of having another person that's helping you through quite a tricky time, I think can really hugely affect the experience of pain. Having access to specialist palliative care services, such as those provided by Marie Curie, can be really helpful, because if I don't know the answer to somebody's pain or what to try next, then I can get on the phone, get advice, and we can usually try something. There may be the occasional situation where it's getting so difficult that we would need to perhaps admit somebody to a specialist palliative care centre and try various options. I have to say, in my experience of 10 years working in a hospice, there are very few people where we can't actually manage their pain to a level that keeps them reasonably comfortable.